Underwood, and I am really excited to share my integrative project with all of you. I am working with Professor Jones, who is teaching Nursing for 11, which is complementary and alternative therapies. It's being offered as an elective course to students in the RN to BSN program at UNCW. I will be implementing my curriculum design in Module 4, which is biologically based practices, and this will include aromatherapy. And I chose Module 4 because I have an interest in and some experience with using essential oils in aromatherapy. I work in the area of behavioral health, and we do employ alternative therapies to care for our patients. And we use essential oils to help reduce stress, depression, anxiety. And so since aromatherapy was already a topic in Module 4, Professor Jones and I felt with my background, this topic would be a good fit for me to use as my practical experience. The use of complementary and alternative therapies, especially aromatherapy, has gained momentum with mainstream medicine. I bet you didn't know that Florence Nightingale used lavender for pain treatment while caring for patients. The need for this innovation has become more necessary as consumers have become more aware of holistic approaches to healthcare. And there's a need to train healthcare workers about alternative therapies because some basic information on alternative therapies is being included in nursing licensure examinations. My reason for choosing this innovation is that many of these alternative practices, essential oils, aromatherapy, are unregulated. So the more that information the students have, the better they will be able to protect the safety of their patients and will help improve the quality and application of aromatherapy. I've actually found some information to applying to COVID-19, where a study out of the University of Texas has been working with nurses using aromatherapy and putting a few drops just in the mask that they're wearing for 12 hours, and they've reported a really good success with that. They pick an oil that they like. You start with one drop, and they have had quite a bit of success and positive outcomes with this. There was an article that I also saw recently that said, you know, when you use aromatherapy, you use essential oils, you breathe them in, it goes to the nose and up to the brain and targets certain areas because they are chemicals that have physiological effects. Many of these oils that I will be talking about with my course, such as lavender, will target the area of the brain that's good for relaxation, or peppermint will target the area that's good for being awake and alert, and ginger will target an area for nausea. So there has been evidence, it is a science, that using essential oils during COVID-19 has had a positive effect on emotional well-being. My project is being offered virtually, which does present some challenges when you are trying to implement a project about a sense. As mentioned, these are students in the RN to BSN program. We have 29 students enrolled in this course. They are all employed as RNs and come from various employment backgrounds and settings. My purpose is to introduce some common oils and their uses. I will be doing a voiceover PowerPoint to talk about how these oils can be used for depression, anxiety, stress, and the oils I have chosen are lavender, bergamot, and clary sage. Now, I didn't want the students to have to go out and purchase these oils, so I will also be describing and giving information on oils that are spices that you may have or they may have in their kitchen. So I'll talk about basil, cinnamon, ginger, and these are spices that can be made into oils. And interestingly enough, these do help with depression, anxiety. Many of them are used for tension, headaches, indigestion, and inner strength, which may be very relevant to what is happening with the medical workers during COVID-19. In addition to the PowerPoint, I gave the students a survey at the beginning of the course just to assess their knowledge of aromatherapy and essential oils. It was not for a grade. It was only 5 questions, and they were all gracious enough to complete the survey. During Module 4, I will also be asking them to watch a YouTube video entitled Aromatherapy 101, 3 Facts to Know. It's about a less than 3-minute video. There will also be downloaded information for the students, references such as lists of essential oils, what they're good for, and how they should be used, such as inhalation, external application, and ingestion, and how they should be used safely. The theoretical basis for my project, I chose two learning theories. I chose Kolb's constructivist model as well as Bandura's social cognitive theory. Both of these propose that learning occurs from observing and incorporating information from others' behaviors, and that student learning happens when new meanings are integrated with existing ideas. So if we have an existing idea about what an oil will smell or is used for, and then we give the idea that, hey, this can be used for stress or anxiety or whatever, then we are integrating new meanings to something that is already an existing idea for the students. Both of these talk about engaging online and having students, really engage with instructors and with each others. And this engaging in active learning is the guiding emphasis of constructivism and social cognitive theories. We're going to be using the learning management system of Canvas, and I have several articles for the students, but I just wanted to read this to you to give additional evidence to why this innovation project is necessary. In the effectiveness study of nurse-delivered aromatherapy, pain, anxiety, and nausea were all found to be reduced when patients were administered essential oils adjunctive to their usual care. Everything that we do in a classroom is being done online, including setting goals for the course, describing specific objectives, defining required tasks, and creating relevant assignments. Online courses, require the instructor to be much more of a moderator or facilitator. And so we have lots of requirements each week that necessitates the students' involvements, such as discussion boards where they're broken down into groups and they have to post and respond to each other. My intended outcome, my hope is that the students will become more familiar with alternative therapies, especially using essential oils. Assessment-wise, the students will be working on a project called The World is Shrinking, in which they will compare both pro and con of biologically based medicine, hopefully choosing aromatherapy as I have given them some information on this. In addition, we will be giving them 4 articles. We're asking them to read 2 out of the 4 and then discuss those on a discussion board. My hope is that they will have learned from the sources offered to them to provide insight into alternative therapies and essential oils. The students will be given a 5-question quiz, once again, not for a grade, just to assess and evaluate their knowledge of essential oils. They will complete a survey, of course, at the end of the course, giving their feedback about the course. That will be too late for me to implement into my project, but we are going to offer them a survey at the end of Module 4 to see if this is a subject they felt was important and whether they felt they could incorporate anything into their own practice. I do feel that some of my intended activities will give me a good idea of how the project was received and if knowledge was obtained. And I'm really looking forward to implementing this next week. Thank you.